Important message. Heart disease remains the leading cause of death in the United States. Millions of people across the United States, United Kingdom, Canada, and Australia are battling high blood pressure, clogged arteries, and heart failure every single year. But science proves that certain superfoods can significantly boost heart health naturally, reduce cardiovascular risk, and may even reverse existing damage. The first superfood that has powerful heart protective properties is salmon. In the United States, cardiologists frequently recommend wild-caught Alaskan salmon because it's extremely rich in omega-3 fatty acids, specifically EPA and DHA, which reduce systemic inflammation, lower triglycerides, and stabilize heart rhythm. Inflammation is now recognized as a major root cause of heart disease, not just cholesterol. You could be someone eating healthy your entire life, yet if your CRP, C-reactive protein, is elevated, your arteries are likely inflamed and at risk. People in the U.S. who consume fatty fish like salmon at least twice per week have been shown to lower their chances of dying from sudden cardiac death by over 40%. That's a massive number. Omega-3s also help keep the endothelium, this thin layer lining your arteries, flexible and smooth, preventing clot formation and plaque buildup. And the American Heart Association has repeatedly emphasized how critical it is to get enough omega-3s from whole food sources instead of just relying on pills. The second powerful superfood is avocados. Commonly consumed in the United States and increasingly popular in Canada and Australia, avocados are a unique fruit loaded with monounsaturated fats, the same type of heart-healthy fat found in olive oil. This fat helps raise HDL, good cholesterol, while lowering LDL, bad cholesterol. Avocados also contain potassium, more than bananas, and potassium is essential for regulating blood pressure. In fact, many people in the United States suffer from hidden hypertension, where their blood pressure spikes only during stress or sleep, and potassium-rich foods like avocado help reduce this risk naturally. Avocados also contain glutathione, a powerful antioxidant that protects the heart from oxidative stress. When your body lacks antioxidants, your arteries become vulnerable to damage from free radicals, especially when combined with high blood sugar or smoking. People in California and Florida often incorporate avocados into their daily diets, and cardiologists have seen dramatic improvements in lipid profiles, arterial health, and even insulin sensitivity, which is crucial for reducing metabolic syndrome. Another top-tier superfood for your heart is blueberries. In the United States, blueberries are now among the most researched fruits when it comes to cardiovascular protection. What makes them so special? They contain anthocyanins, these deep blue pigments, that offer extraordinary anti-inflammatory and antioxidant benefits. Several studies conducted in the United States and the United Kingdom show that regular consumption of blueberries can reduce blood pressure as effectively as prescription medications without the side effects. Anthocyanins also help prevent the oxidation of LDL cholesterol, a key factor in atherosclerosis. The problem isn't just having LDL cholesterol, it's when LDL gets oxidized and triggers inflammation in the arterial walls. Blueberries help stop this process. A Harvard study found that women who consumed 3 servings of blueberries or strawberries per week had a 32% lower risk of heart attack. That's not a small benefit. That's life-saving. You could be doing everything right, but if oxidative stress is damaging your arteries from the inside, you need antioxidants like those found in blueberries to repair and protect your cardiovascular system. Plus, blueberries have a natural blood-thinning effect, which improves circulation and reduces the risk of clot formation. Another incredibly potent heart-protective superfood is oats, especially steel-cut or old-fashioned oats. In the United States, oats are a breakfast staple, but not all oats are created equal. Instant oats are often stripped of their natural fiber, and worse, packed with sugar. But real oats, especially minimally processed, contain a unique type of soluble fiber called beta-glucan. Beta-glucan binds to cholesterol in the digestive system and physically removes it from the body, lowering total and LDL cholesterol levels. People across the United States, United Kingdom, and Australia who eat just one bowl of oatmeal daily often see measurable reductions in LDL cholesterol within weeks. Fiber also slows down glucose absorption, reducing the insulin spikes that damage arteries over time. What many Americans don't realize is that metabolic syndrome, insulin resistance, and prediabetes all increase heart attack risk, even if cholesterol levels look normal. By stabilizing blood sugar and improving gut health, oats help lower systemic inflammation, a massive factor in coronary artery disease. There are even studies that show beta-glucan reduces arterial stiffness, improves endothelial function, and lowers blood pressure over time. Next is dark leafy greens, especially kale, spinach, and collard greens. These vegetables are rich in vitamin K1, folate, nitrates, and antioxidants that support the heart in multiple ways. Vitamin K1 prevents calcium buildup in the arteries, which is a lesser-known but very real problem across the United States and Canada. When calcium ends up in your arteries instead of your bones, it causes hardening and narrowing of vessels, which makes it harder for the heart to pump blood. People in the United Kingdom often consume leafy greens daily as part of their traditional meals, and cardiovascular mortality rates are lower in populations with high green vegetable intake. These greens are also loaded with folate, which helps lower homocysteine levels, a toxic amino acid that damages arteries when elevated. Many Americans are deficient in folate and B vitamins, which quietly increases their risk of stroke and heart attacks. Nitrate-rich greens like spinach are converted into nitric oxide in the body, a compound that dilates blood vessels, reduces blood pressure, and improves circulation. This is the same compound that drugs like nitroglycerin try to mimic, but your body can do it naturally if you give it the right food. In the United States, nitrates are usually associated with processed meats and cancer risk, but natural nitrates from greens have the opposite effect. They heal and support the vascular system. One of the most overlooked heart health superfoods is walnuts. Walnuts are incredibly rich in alpha-linolenic acid, ALA, a plant-based omega-3 fatty acid, and they also contain polyphenols that fight inflammation. In studies from both the United States and Canada, people who consumed just a small handful of walnuts per day showed reduced levels of LDL cholesterol, improved endothelial function, and lower levels of CRP, which is the key inflammation marker related to heart disease. Unlike other nuts, walnuts have a unique shape and nutrient profile with higher antioxidant capacity. Cardiologists in the U.S. often suggest replacing junk food snacks with walnuts to improve lipid profiles. What makes them even more powerful is their effect on the arterial lining. Regular walnut intake makes arteries more elastic, less prone to damage, and improves vasodilation. A study published in the Journal of the American College of Cardiology found that when people replaced saturated fats with walnuts, their overall cardiovascular risk dropped significantly within weeks. This is not just theory. This is measurable, clinical improvement in markers that predict heart attacks. Some people feel that eating nuts will make them gain weight, but the evidence shows that walnuts, when consumed moderately, actually help with weight management by increasing satiety and supporting metabolic health. Next comes extra virgin olive oil, a cornerstone of the Mediterranean diet, now widely used in the United States and increasingly popular in Australia and Canada. But again, the type of olive oil matters. The ones rich in polyphenols, those peppery, slightly bitter oils, are the ones that protect the heart most. Polyphenols are powerful antioxidants that reduce oxidation of LDL cholesterol, fight inflammation in blood vessels, and improve the function of the endothelium. Studies in the United States show that people who use extra virgin olive oil regularly have lower rates of cardiovascular disease, even when they consume high-fat diets. This is critical. To understand, It's not the fat itself, it's the type of fat that matters. Olive oil improves cholesterol ratios, reduces insulin resistance, and helps the body absorb fat-soluble vitamins like vitamin D, which is crucial for heart health. There's also strong evidence that olive oil helps regulate blood pressure naturally, partly due to the polyphenol's ability to relax arterial walls. People living in parts of the U.S. who adopted a Mediterranean-style eating pattern, including daily use of high-quality olive oil, have seen dramatic drops in their blood pressure, weight, and cholesterol medication use. You can pour it on salads, cook with it, or even take a spoonful a day if needed. Another superfood with remarkable heart benefits is dark chocolate, specifically varieties with at least 70% cacao content and no added sugar. Dark chocolate contains flavonols, which are plant-based compounds that significantly improve vascular function. In multiple studies conducted across the United States and the United Kingdom, dark chocolate consumption has been shown to lower blood pressure, reduce LDL oxidation, and improve endothelial function. What's happening at the cellular level is that flavonols stimulate the production of nitric oxide, the same compound that relaxes blood vessels and enhances circulation. A study published in the American Journal of Clinical Nutrition revealed that participants who consumed high flavonol cocoa daily had improved blood flow and reduced arterial stiffness within weeks. But the benefits go even deeper. Dark chocolate also lowers cortisol levels, the primary stress hormone. Chronic stress contributes heavily to heart disease in the U.S., with patients reporting symptoms such as chest tightness, insomnia, palpitations, and fatigue long before their first heart attack. By helping regulate stress responses and supporting vascular function, dark chocolate acts as both a cardiovascular protector and a nervous system calmer. It's important, however, to avoid commercial chocolate filled with sugar, milk solids, and emulsifiers. Those cancel out the benefits. Choose fair trade, organic, low-sugar options with high cacao content to get the true therapeutic effects. Beets are another deeply healing superfood for the heart, and they're finally gaining attention in mainstream U.S. health circles. Beets are loaded with dietary nitrates, which your body converts into nitric oxide, essential for maintaining flexible arteries and normal blood pressure. Multiple clinical trials from both Canada and the United States demonstrate that beetroot juice lowers blood pressure within hours of consumption and improves exercise endurance in people with heart failure. For individuals struggling with high blood pressure that doesn't respond well to medication, adding raw or roasted beets or beet juice can provide measurable improvements. Beets also support the liver, which is often overlooked in heart health. The liver controls cholesterol processing, and a sluggish liver can worsen lipid profiles even if diet is good. Beets help detoxify the liver and thin the bile, which aids cholesterol elimination. Moreover, beets are rich in betaine and folate, both of which reduce homocysteine levels, a major hidden factor in heart attacks and strokes. Too many Americans are walking around with elevated homocysteine and have no idea, because it's rarely tested. Beets also contain betalains, powerful antioxidants that reduce oxidative stress in blood vessels, protecting them from damage caused by high blood sugar and chronic inflammation. Pomegranates are another potent superfood that directly targets the heart and arteries. Pomegranate juice and seeds are rich in punicalagins, unique antioxidants that have been shown to reverse atherosclerosis. In some studies, research from the United States and the United Kingdom showed that daily consumption of pomegranate juice reduced arterial plaque buildup and improved blood flow to the heart muscle. In fact, pomegranate has been shown to increase nitric oxide levels and lower systolic blood pressure in just a few weeks. One groundbreaking study from Israel, referenced often in North American cardiology circles, demonstrated that people drinking pomegranate juice daily for a year reduced their carotid artery thickness by over 30%. That's unheard of with standard medications. Pomegranate also inhibits angiotensin-converting enzyme, ACE, similar to how blood pressure drugs work. For people in the United States dealing with hypertension, Pomegranates can offer a natural way to manage their condition while improving cholesterol profiles. And pomegranate's polyphenols also improve mitochondrial function in heart cells, boosting energy and endurance for those with heart failure or fatigue-related symptoms. Turmeric, especially in its active compound curcumin form, is another critical heart protective superfood. In the United States, turmeric is often consumed as a supplement or added to foods in powder form. Curcumin has powerful anti-inflammatory effects and has been shown to reduce the markers of systemic inflammation like CRP, IL-6, and TNF-alpha. Inflammation is a central player in every stage of heart disease, from endothelial dysfunction to plaque rupture and clot formation. Clinical trials from both Canada and the U.S. show that curcumin improves endothelial function just as effectively as exercise in certain populations. It also helps prevent the oxidation of cholesterol, reduces fibrosis in the heart muscle, and even lowers blood pressure through its influence on nitric oxide production. People in the United States with metabolic syndrome, a combination of high blood pressure, high blood sugar, and belly fat, often see dramatic benefits from turmeric when combined with black pepper extract to increase absorption. Curcumin has also been shown to help reverse cardiac hypertrophy, a condition where the heart muscle thickens due to chronic stress or high blood pressure, leading to heart failure if left unaddressed. By targeting multiple pathways, oxidative, stress, inflammation, lipid oxidation, and endothelial dysfunction, turmeric provides a full-spectrum defense against cardiovascular deterioration. One more incredibly powerful and yet often underestimated superfood is chia seeds. Popular in the United States and Australia among wellness circles, chia seeds are tiny but pack an enormous punch when it comes to heart health. They are loaded with plant-based omega-3s, ALA, soluble fiber, and antioxidants. The fiber forms a gel-like substance in the gut that binds to cholesterol and sugars, reducing their absorption and promoting stable blood sugar levels. In the U.S., where prediabetes and type 2 diabetes are affecting over 100 million people, stabilizing blood sugar is one of the most critical strategies for preventing cardiovascular events. Elevated blood sugar leads to glycation of proteins, causing damage to the blood vessels over time. Chia seeds also promote a feeling of fullness, which helps with weight control, an essential part of managing blood pressure, cholesterol, and blood sugar. Studies show that chia consumption leads to improved HDL levels, reduced triglycerides, and better control of inflammatory markers. Chia seeds can absorb up to 12 times their weight in water, which also helps with hydration and detoxification, improving overall vascular function. Whether added to smoothies, yogurt, oatmeal, or used to make puddings, chia seeds are one of the easiest and most effective additions to a heart-healthy diet. Another extraordinary superfood with direct benefits for the heart is green tea, especially matcha, which is more concentrated. Green tea contains catechins, antioxidants that protect LDL from oxidation, reduce blood pressure, and improve cholesterol ratios. In the United States, green tea is becoming a more popular alternative to coffee, and for good reason. Studies show that people who drink green tea regularly have lower risks of stroke and heart attack. One reason is that catechins improve blood vessel flexibility and reduce inflammation. Green tea also contains theanine, a compound that calms the nervous system and reduces stress-related blood pressure spikes. Chronic sympathetic nervous system activation, what we feel during stress, can damage the heart long-term. Drinking green tea helps modulate this response, supporting both heart and brain health. Matcha, which uses the whole powdered leaf, contains even more catechins and chlorophyll, offering deeper detoxification and cardiovascular protection. Americans trying to quit sugary drinks or reduce caffeine find matcha to be an excellent replacement that supports rather than harms heart function. Fermented foods like kimchi, sauerkraut, and kefir are essential superfoods for maintaining a healthy gut microbiome, and emerging research shows a direct link between gut health and heart disease. In the United States, gut dysbiosis, an imbalance in gut bacteria, is being linked to increased risk of atherosclerosis, hypertension, and chronic inflammation. One of the harmful byproducts created by bad gut bacteria is TMAO, trimethylamine N-oxide, which has been shown to directly increase plaque formation in arteries. Fermented foods introduce beneficial probiotics that crowd out harmful bacteria, improve digestion, and lower systemic inflammation. By restoring balance in the gut, these foods reduce the production of harmful byproducts that damage arteries. In Canada and Australia, the use of fermented dairy products like kefir is increasing in heart-conscious communities. These foods also improve nutrient absorption, especially magnesium, vitamin K2, and B vitamins, which are crucial for vascular health. The fiber in fermented vegetables also acts as prebiotic fuel for the good bacteria, creating a cycle of healing from the inside out. Cardiologists are beginning to recognize that healing the gut is not just about digestion, it's about healing the heart, reducing arrhythmias, and even improving outcomes in congestive heart failure patients.